CDI, Clinical Documentation Improvement, but we've also heard it as Clinical Documentation Integrity. It's a popular topic, but what's the deal? In today's video, I will briefly answer some of the basic questions about CDI and talk about how you can get into a career in clinical documentation integrity. Hello geeks, this is Brian Kui from medicalcodinggeek.com. I've spent about 12 years as a CDI specialist working for a healthcare system in many specialties, and I created this channel to share my experience and insights in the CDI industry. I will be going over some of the common questions I get asked frequently. Question number one, what is clinical documentation integrity? CDI is a continuous process of reviewing clinical and physician documentation to identify potential documentation opportunities to accurately reflect the severity of illness and appropriate level of care for the patient. Now, that definition may seem a bit weird, but when I answer the next couple of questions, CDI will hopefully make sense to you. Question number two, what is a CDI specialist? Now, the best way I can explain what a CDI specialist is if you take a nurse and you take a medical coder and they got together and they got married and they got busy and basically they would have what I would call a CDI baby. In this case, that's a CDI specialist. So if you take the nursing skills of a nurse and the medical coding skills and the understanding of medical coding guidelines of medical coder, you would have a beautiful CDI baby. So going back to my first question, basically what CDI is when I mention physician documentation, you have to start there. Physician documentation includes things like history and physical, consultation notes, operative reports, and progress notes. From the physician documentation, they document diagnoses and procedures. From those diagnoses and procedures, you have a medical code assignment. And from that medical code assignment, you have a specific medical code description. Now, the problem is that there are gaps between what is documented and the medical code description, and it can result in non-specific medical codes. The result in non-specific medical codes can result in loss recognition and reporting of severity of illness, which basically is how sick a patient is, and most importantly, resource consumption, which is supplies and the staff needed to take care of the patient. To make a long story short, a CDI specialist bridges the gap between the medical codes and the physician documentation. And this would lead to my third question. What does a CDI specialist do? The CDI specialist bridges that gap that I mentioned earlier through medical record reviews. In those medical record reviews, they identify potential documentation and clinical deficiencies. Now, I break it down in two ways in where you could seek opportunities as a CDI specialist through your medical record reviews. Number one, it is clinically present but not documented. This goes beyond what medical coding guidelines indicate that medical codes cannot be assigned based on non-physician documentation like laboratory and imaging reports. And the second is, it is documented but not clinically present. And based on these findings, the CDI specialist will create a query and send it to the physician. This could be verbal, written, or electronic. After the query is sent, the CDI specialist follows up with the physician so the query is answered. And if necessary, physician education is provided. If the physician does not understand the query or has questions about the query or continues to provide documentation that is vague and requires more attention. So the next question is, how can I or how can you become a CDI specialist? Before answering that question, let's address the question of who can become a CDI specialist. Now, do you need to be a nurse to be a CDI specialist? My immediate answer is no. Unfortunately, there was a trend of employers requiring CDI specialists to have a nursing license. And I've also seen CDI specialists being referred to as CDI nurses. When CDI first started in the early 2000s, because I started back in 2005, medical coders, HIM professionals, and nurses were eligible to become CDI specialists. Today, we're bringing diversity back to the table and also including ancillary professionals, including respiratory therapists. Foreign medical graduates are also qualified to take on this role. A qualified CDI candidate should be able to bridge the gap of understanding the medical record and understanding the disease process, and also apply the full architecture of the medical coding classification system, including diagnosis-related groups, which can be done in a separate video. As far as certifications, here's what's currently on the market. The first credential is the Certified Clinical Documentation Specialist, which is brought to you by the Association of Clinical Documentation Integrity Specialists. Now, they also have what's called the CCDSO, Certified Clinical Documentation Specialist Outpatient as well. Now, the ACDIS credential, the CCDS, requires that you have 2 years of experience in order to obtain or sit for that credential. The next credential is the Clinical Documentation Improvement Practitioner, which is brought to you by the American Health Information Management Association. Previously, they did have a 2-year experience requirement, but now they made that a recommendation. You also have the Certified Documentation Expert Outpatient, which is brought to you by the AAPC. There is no experience recommendation or requirement for this credential. Can you be a CDI specialist without a credential? When I first started CDI, I only had my RHIA, but moving into now, the pool of CDI professionals or candidates is very saturated. Everybody wants to get into CDI. So to stand yourself apart from the rest of the market, you would definitely need to have a certification. If you are interested in CDI, where should you go? And I'm going to give you 2 recommendations. The first recommendation is the Association of Clinical Documentation Improvement Specialists. Their website is acdis.org. And also you can go to the American Health Information Management Association, which is ahima.org. Both links I will place into the video description. Now, to learn more about how I got into CDI, you can check out my interview where I'm asked about CDI on the Includes podcast with Marlene Marino, and also the Alpha Coding podcast with Tony L. Holmes. On top of this video, I've also curated previous episodes from my podcast, the Not Elsewhere Classified podcast, with professionals who are passionate about CDI in the video description below. This video just brushes the surface on CDI. So I speak at local and regional medical coding, HIM, and CDI associations with my presentation called The CDI Mindset, which goes over the history of CDI, the requirements of a successful CDI program, and how I understand the disease process and also the query process. If you'd like me to speak at your local chapter or association, reach out to your local officers and refer me. So after watching this video, are you interested in clinical documentation integrity? Do you have questions about CDI? Feel free to post your questions in the comment below. Thanks for watching this video. If I piqued your interest in CDI, hit the like button and subscribe to my channel for more videos on medical coding, HIM, and CDI. And I'll see you in the next video. D, or D, how is it spelled? Yes. Start again. Opportunities. Why am I scratching my head again? Really? Hello? So that the answer is correct. I can't believe I wrote that thing. I was interested in Start it again. No, wait. Wait. Go back. If you like to, if you like me to speak at your local chapter, so boom, boom. Yes.